Spent the day with my brothers and my father. So I was driving back, got caught in the rainstorm, and found myself hydroplaning and losing control of the vehicle, sliding off the roadway. And I looked to the left just before the impact, and all I remember is a telephone pole. I was taken to a local hospital. They treated me in the ER, realized it was a level 1 trauma type of situation. That's where Loyola came into play.
From this point on, he was worked on at 1 o'clock in the morning until about 7. They worked for 6 hours to stabilize him.
In many cases, this would have been a fatal accident. He got very lucky in some ways. He had pretty significant injuries to his chest. He had punctured lung and broken ribs. He had a pretty large liver laceration. The general surgery trauma team did an incredible job essentially saving his life. They had pretty intensive resuscitation for him, and they were able to get him to a point where we could do all of his orthopedic surgery in one setting.
I get a little choked up thinking Dr. Cohen has been fantastic. I mean, just in terms of his professionalism, his ability to communicate, and obviously the so-called hands of a surgeon, outstanding, remarkable.
His right femur was broken in multiple different pieces. His pelvis was essentially split in half. And when that happens, there are a lot of blood vessels and nerves that are in the pelvis that also can get injured, and often just the pelvis injury in itself is a life-threatening injury.
Didn't know what the full outcome was going to be, and I said, well, will he walk again? I mean, this was broken pelvis, femur, and he said he'll be on a bike in 2 weeks, and I just couldn't even get over it, but all because of his skill.
I was in the hospital for 3 weeks at Loyola. The level of care I received at Loyola, having been exposed to the nursing staff there, unbelievably caring, empathetic. These are people that I'm convinced who were there because they wanted to be there. They chose this hospital. I certainly felt the difference of that type of engagement day to day.
He spent about 3 months with really limited weight bearing until we had signs that his bones were going to heal. And then at that point, we could really start aggressive therapy for him.
Thanks to Dr. Cohen and the entire team at Loyola, back in the spot of biking, certainly walking, and to spend time with my family, quality time, instead of the alternative of, frankly, what could have been the outcome of this accident.
Greg has been essentially an ideal patient. He's worked really hard on his end trying to get back to the life he had before the accident. So I really look forward to seeing him every time he comes into clinic. I think he just showed me a picture of him and his family after climbing a mountain in Arizona. The coordination of care amongst so many people in the hospital really changed his life.
Fortunate and lucky not only to be here, but also to have been placed in the capable hands of the team at Loyola to get me back on this path so that I can continue the important parts of my life with my wife and family.